Hello, good morning. My name is Chooks. So today, my presentation will be based on a prescribed medication for a 60-year-old male patient with a diagnosis of um, hypotension. So the prescription for him would be uh, Midodrine. So Midodrine um, has been proven as a medication for people with symptomatic um, orthostatic hypotension. And for this patient, I will be talking about the pharmacodynamics, pharmacokinetics, and also I'll be talking about the um, pharmacotherapies of the medication. So let me begin by discussing about what the Midodrine does. So like I mentioned, Midodrine is for the treatment of symptomatic static hypertension. And for the pharmacodynamics, the administration of Midodrine results in the rise in standing, sitting, and supine systolic and diastolic blood pressure in patients with orthostatic hypertension of various etiology, various cause. So it is expected that the blood pressure will increase by approximately 10 to 30 millimeter per mercury at about an hour after 10 milligram dose of Midodrine. So how does this medication work? The mechanism of action: Midodrine undergoes metabolism to form its pharmacologically active metabolites. That's this glycomidodrine. How this works: so this glycomidodrine acts as an agonist at the alpha adrenergic receptors. So these are receptors that work in the vascular smooth muscles, and what it does, it creates a pathway to increase the vascular tone and thereby increasing blood pressure. So so it helps to constrict the vessels, thereby increasing the blood pressure. So how is this medication absorbed? So it is absorbed rapidly following oral administration. The peak plasma concentration of the prodrug is reached about an hour after taking the drug. So it is expected that within an hour, the drug takes its effect. So talking about metabolism of the drugs, there is no indication about how it is metabolized, but it is expected that the drug is metabolized in part by the liver. Okay, so again, the metabolites display a half-life of about 3 to 4 hours. So that's the half-life of the medication. So the drug is expected to be taken 3 times a day. The first dose at the beginning of the day, the second dose during lunch, and the last dose like around 6 p.m. in the evening. And it's expected to be in the 10 milligrams. What else about this medication? So some of the information for the patient will be basically to inform the patient um, to take the medication as prescribed, do not overdose. Um, Patient you should not take the medication at least 3 hours, should take the medication at least 3 hours apart. The drug should not be taken after dinner or within 4 hours of bedtime. The patient should avoid driving and other hazardous activities until he or she knows how the drug affects his or her concentration, vision, and alertness. So that is all for Midodrine. So it helps to increase blood pressure. Um, Medication comes in 2.5 milligram or 5 milligrams. So if it's 5 milligrams dose, so patient should take 2, which is 10 milligrams as an adult, and to be taking 10 milligrams 3 times a day. Thank you.